There we go. Hey, how are you doing? How's your day?
It's good. How's yours?
Doing great. Doing great. Long class. But
Last was it?
I just have a couple of questions I would love to ask you. I think the first one is how do you get in the field of product design, and what path did you take to reach your current position?
So I started, my undergrad is in product design and development. So I interned at originally I wanted to do outdoor product design. So I interned I had a stint at Scott Sports on more of an engineering side of things. And then wanted to go work at a couple other design houses, but ultimately found a internship with a company called Tech Medical.
Hmm.
I interned there, which converted into a full-time role for me.
Okay. Did you I,
So
I also noticed that you did an internship with I can't remember the name of the company, but it
BD.
was yeah.
So that's where I'm at right now. So let me give you my whole story to kind of paint a picture.
Okay.
So I spent 4 years in outdoor product design and development where where I wanted to learn how to do skis, ski boots, clothes, fashion, bicycles, all of the outdoor great ways to explore the outdoors.
Okay.
That ended up giving me the skills to transfer into my internship where I work on a medical back brace. I then was able to negotiate and say, hey, um, I think I'm good at this job. They made a role for me. I went product designer one, product designer two, and then said, hey, I want to be involved in the front end of product development, so more of the marketing side.
Mm-hmm.
And then I decided that also where I wanted my career to be able to grow, I wanted to get an MBA. So I went, now I'm in my MBA with the primary goal is in business strategy and like marketing, where I'd like to go is step into the industry through kind of the marketing doors, learn and understand the industry, and then eventually get up into a managerial role. But so how I got into the role with BD is I went to a convention and with my history and background was able to interview and apply that way. So hopefully, I don't know, not sure if that answers your question fully, but let me know if there's anything that I may have missed.
No, yeah, that works. That makes sense. So you want to enter, you're already in the industry, but you want to go through another approach. So you want to go
Yeah,
into the
so
side.
so I'm pivoting out of kind of the boots on the ground product designer role.
Mm-hmm.
Mostly the reason for my pivot is because I don't have a mechanical engineering degree. It's not clear cut this way, but it seemed to me that my ability to grow in significant ways was somewhat hindered by not having a mechanical engineering degree. So rather than kind of have to sit and just wait for time to be kind, I chose to get my MBA to give me the business skill sets and business tools to pivot into a different role to get me to the same end goal of being a medical innovator, which is what I love to do.
Okay. So you're not so much interested in, you wouldn't want to be a mechanical engineer.
Mhm.
Okay. Okay, that makes sense. Could you describe to me what a typical day looks like for you as a product designer?
As a product designer, yes. So where I worked, we were considered lack of a better term, we were a design consultancy group where and an OEM. So we did both original point of manufacture and basically what we would do is on a Monday. So if it was Monday, we typically in the beginning of the week we would have morning meetings with our clients to give project updates. Say, this is where we are at, this
Mm-hmm.
is where we're going, these are the challenges we've had. Um, but then the remainder of the day was spent often in a CAD software or in the design lab, breaking and blowing stuff up. Where the best way to know if something's going to work is you hit it with a hammer, or right, or if it needs to be strong, you push it to its limit. So that's kind of the fun part of doing product design is we were able to you know, be in the lab breaking things or just letting your creativity run wild. So that was really fun. but so I'd probably say meeting wise, I probably have 1 to 2 hours of meetings a day, whether that's internal meetings or client facing meetings. Then maybe an hour of like brainstorming.
Mm-hmm.
Oh, kind of would be hit or miss, but the majority of it was working in concepts and designs, but then also the non-glamorous part was so in the medical field, you can't just do something and deliver it, right?
Mm-hmm.
You have to, right? And so the process goes, you have an idea, you create a series of inputs or user need statements as to what you're trying to solve. And
Mm-hmm.
then what you do is you create design outputs that satisfy those inputs.
Okay.
That makes sense, that journey. And so then once you have a design, you then have to prove and test that it does what it's doing. So then you have to build what's called a test protocol to say, like for example, let's say we're working on a knee implant. You
Mm-hmm.
can't just say that the knee implant works. You have to then go and do studies and objective, controlled evaluations of that product to ensure that it's going to be safe for the patient and that it's going to have the longevity that it needs.
Okay.
And then after that, this is like the non-glamorous part. You have to write the report. You have to say, this is what happened. This is why either it's safe or it's not safe. And then you move, and that's what would be called a qualification phase. Well, that's what we called it,
Mm-hmm.
where you do benchtop testing. You just use all sorts of different forms of testing. And then you have to the last part of the design phase is what's called V&V, which is verification and validation testing, where you have to produce the product in the exact same way it's going to be in the finished good. You
Mm-hmm.
have to test it in a lab setting. So either that's a cadaver study or you have to you test it in real patients.
Oh.
Um, Depending on the classification, if you're a class 1, 2, or 3, the amount of work you have to prove um, changes, which then you have to get into some of the product legal law. So, for example, I know you're working in bench to bedside. A
Mm-hmm.
lot of the products that they'll try to use and benchmark is based on a 510K. So what a 510K is there's already a product in the market that does what you're doing, and
Yeah.
that's established a mode of care. So what you do, let's say once again, we'll use the knee implant. Let's say you have a great idea for an improvement upon a knee implant. Well, you don't have to go and do all of a full round of testing again. You just have to prove with objective evidence that your design is as good, if not better, than the predicate device.
Okay. So it's
Uh,
just work building upon work.
yeah, so you start with an idea, and the way I work now is you can't just say it's like when you're writing a paper, you can't just make all of these pointed opinions of like this is what's happening in the industry because I'm a brilliant student. That's just why. You
Mm-hmm.
have to say, in this reputable source, they indicate inflation's going up. In this source, they indicate the housing market's going to do this. So you have to cite your sources and prove through objective evidence that what you're creating is real
Okay.
and it's doing the right thing.
Okay. And I guess that leads into my third question is what skills and qualities do you believe are essential for success in product design? It sounds,
Um,
it sounds like it's a lot of collaboration, but also a lot of innovation and creativity.
yeah, I think, from my experience, the hard skills can be taught.
Okay.
The things that cannot be taught are attitude, tenacity. Like it's all about what's like your internal drive. I like, right? Like I can't I can't teach you to be creative. Some
Mm-hmm.
people in someone might argue, but I've found it's either you are or you aren't.
Mm-hmm.
It's like what's your baseline, right? And the same thing is like um curiosity. right? Like that's perhaps one of the most undervalued um, skills that I think is overmissed. You know, you look at like 4, 5, 6, 7, 8 year olds, they're
Yeah,
curious about everything.
yeah.
Tell you're making pasta, why is the water boiling? And they just want to know why. And I think if you have that natural curiosity, just feed your inner child and just challenge of why does something work the way it does? What and why, but don't just leave it at why, but say why doesn't matter. What's significant about this? But I mean, there's the baseline, right? Problem solving skills, all those, and like specifically for product design, an ability to sketch, if that's something you're interested in. A way to communicate your idea on paper or
Mhm.
through some form of medium is critical.
Okay.
Because, and I mean, even if it's a digital product, they use sketching to create a basic website. You can say, we can do something here and then over here. But yeah, so I think there's like the base toolkit you need to know is if you can build a skill set around SolidWorks or 3D modeling. An ability to sketch is critical.
Mhm.
Because if you're in a situation where you're just trying to say, this is what I'm thinking, well, sometimes it takes hours to model something, but if you can just quickly sketch and get a rough idea of say, this is about what I want it to do, then you can quickly iterate without ever having to spend any time in a software.
So it's about communicating ideas fast.
Yeah,
Yeah.
perfect.
Okay, that makes sense.
And
And
I
then
think the other, you go.
no, go for it.
I think the big part is like being humble too. Like, and when I was in school, they learned like no one likes to hear their baby's ugly, right?
Mhm.
You're never gonna walk up to someone and say, "Well, what happened? Like that baby doesn't look very cute." Or if you do think that, you just don't say anything, right? But the be willing to be humble enough to let someone say your idea is bad,
Mhm.
and but to not just accept it, but to challenge them. Okay, so and that's the other point that's important is learning how to give pointed feedback. So like you know let's say you were commenting on like the shape of my glasses, right? Let's say you don't like the little facet right here, but don't just say you don't like it because so, a million people have a different preference on like. However, if you say I don't like it because the way it frames your face, or like um, if there were like a great one is like color combinations. So if you say I don't like this color combination because they clash or because within the market space we're going into, it doesn't meet the customer needs that we're looking into. So those
Mhm.
are kind of like the ability to articulate critique is absolutely crucial. So I'm
Mhm.
sure you've even seen in your own, if you've ever been in a group project, there's a lot of groupthink that occurs where no one wants to offend or hurt the feelings of someone who's worked really hard on something.
Yeah.
But there's no value in that. Right? If
Mhm.
everyone just says, "Oh, it looks great," and then you guys all get a bad grade, and say, "I told you it was bad," it's like, well, yeah, everyone could have told you it was bad after you got the bad grade. The
Mhm.
challenge is being able to speak up and say, "Hey, I don't like this because of this," and you can articulate that. I mean, there's a whole way you can communicate that and not be offensive and rude. But I think the ability to give pointed, directed critique is absolutely critical and beyond just product design.
Okay, that makes sense. And as a question, when you're in this brainstorming kind of phase, how much is expertise and how much is intuition when it comes to like the product?
I think it depends. I think it's a balance of both, right? So when you have a better understanding of whatever thing you're working in, you understand the limits of what you can and can't work in. But
Mhm.
just because you understand the limits doesn't necessarily mean you're going to come up with a better thing,
Mhm.
right? Because if there was this understanding that humans can't fly, and that was just what everyone accepted to be fact, then no one would have ever tested the limits, right? So I think the important part is be able to be intelligent enough to know, like to learn, like and these are the things you can learn. You can learn how a material behaves, the limitations of a material, right? Like, but then don't just leave yourself in that box, because perhaps you could create something else.
Yeah.
So, but then there is a level of an intuition, like, right, that's where the creativity really comes in and really can shine, is kind of like I'm like, consider, like, think about Taco Bell, right? Think outside the bun, right? Like, you have this set parameters, and if you ask the question, but what if we do this with this and this, and then like you just try it. So I say it's, you kind of live in this very fluid, like, you have a solid understanding of the limitations of different processes or materials, and use it as a foundation, not a crutch. Because let's say you have an excellent idea and there's a limitation with which you can accomplish that with the current abilities of the market. Well, that doesn't mean the idea is dead. It means you can invent a new technology. And then you have a proprietary way of doing something that nobody else can do.
Yeah. So half and half.
Yeah. I think you bounce, like, it's like ping pong. You go back and forth really fast.
Yeah, that makes sense. How do you stay up to date on the latest like design trends, tools, and technologies? Because there's innovation happening so fast lately. How do you keep up with it?
Um, I think there's great journals, right? Like, if you're really into 3D printing, right? There's as a general rule, I think there's a guiding association within each major discipline. So that's one great way. The other good way is to look at your competitors. Like, what are your competitors doing? What are they marketing? What is the grapevine sound like, right? But the best part is, like, look at what competitors are doing, but also, like, I also kind of like having a certain level of removal from what everyone else is doing. Because if you're just looking at what everyone else is doing, then you're just going to end up with a similar solution. Right. And so I think the other part that's critical is understanding your customer, the consumer, right? So the faster you can either connect with or become that customer, the faster you understand those pain points and those limitations of what's available. So I know what's your favorite hobby or activity to do when you're not doing school?
I'm very much into plants. I like houseplants.
Okay, so, right, think of all of the different ways you can or can't grow a plant.
Yeah.
Like, if for me, I'm not a big plant grower, so it'd be really hard for me to understand all of the things and the needs that go into that. So a really quick way is to just start doing it yourself.
So
And then you can quickly understand, oh, it'd be really nice if, I had a special pot that told me if it was dry, if it was running low on water. Like, that's like that, then I would just know when to water my pot.
Yeah.
So that's, sorry, hopefully that answers the question.
Yeah, so try to connect with the customer as much as possible, and then
Yeah.
use tools around you.
Yeah. And then there's trends, like, I know with like colors, there's like if you're really into color theory and all of that, like Pantone actually has like a color of the year that they forecast colors. And so you can actually, there's a whole industry that's trying to find what's going to be on trend for colors. And so, like, if you're super into fashion and like fashion's where you want to live, then you look at the runway, what's coming down the runway and what's being considered like cutting edge. But you can look at trends, like there's lots of trends in this. There's always a trend. So
Yeah, and that leads me to my last question. What are the biggest challenges and trends that you see in your industry right now?
right now, the biggest challenge with respect to the medical device space is that the rate at which the reimbursement rate for devices and inflation aren't matching.
Okay.
Right? So the the geopolitical events going on in the world lead to an increase in your raw materials. And those raw material increases trickle all the way up to that finished product and beyond, because like hospitals, right? I had a conversation with our team the other day in a presentation the other day where a big part about hospitals is food management and the like serving and catering and providing of food for patients. Well, if the overall market goes up 10-15%, they're not getting reimbursed anymore for the cafeteria salad they're providing their patients. So that goes to a direct bottom hit to their bottom line. Right. So that's probably the hardest thing. But then from like an actual design standpoint, I think the challenge is that the world is getting smarter and faster, and the speed at which it can innovate is constantly increasing in speed. I think the biggest challenge is to want to go outside of what your core value and what your core competencies are, because of like, ooh, it's shiny, right? Ooh, we could add this really exciting technology into our system. But I think the important thing is you have to ask the question, should I make this a smart device, or can it be a dumb one? And depending on which angle you go, like more often than not, the dumb one's the right answer, in my opinion.
Okay. And I guess a follow-up question, how's your industry interacting and adopting AI?
It's actually a really cool. I know like my specific group doesn't do a lot with it yet, because the challenge with AI is that it's not 100% accurate, right? So you can't put all of your trust in it. But the true value, like I know there was I think during COVID, there was a PhD article that I read, or a study, where they used and took a database of either X-ray, some type of image pulled from patients with COVID. And they were able to generate, or maybe not COVID, it was some disease. It's lung related, but I don't recall which disease it was. But what they were able to do is use AI to recognize early patterns. No, it's breast cancer. Totally 180. It was in breast cancer, where they were able to catalog and database and teach the system to learn. And they're able to actually identify through CT scans and MRI imaging the likelihood that a specific group of cells is going to be malignant. And so, right, you go and do your mammogram, they run it against this database, and based upon the morphology and the topology of the cells inside the breast tissue, they can get a chance to learn that way. I think that's where a lot of the diagnostic options will be really cool. But the challenge is it has to be less, in order for it to be fully adopted, it has to be less error prone than a physician and a clinician. That's what I think. But going back once again to like the design space, I think one really cool space design creation is what's called generative design, where you can go and apply different loads to something, and you can actually have the system optimize your structure to support the load without needing to have all the waste. So you could combine AI with 3D printing to create really custom things, right? Or like another cool one, it's more of a machine learning algorithm, but in like orthopedics, they're moving toward what's called patient specific instrumentation, where like your ankle bone and my ankle bone are different. They're different size, topographical features, and all of that. And so what they can actually do is they can go through and segment and CT scan and create a profile of what your bone looks like. And then they can feed that into a model and actually create a custom cut guide for your ankle procedure. And so I think the power of AI is going to be in the way in which you can iterate and kind of run through a series of systems. Well, you opened the can of worms. Another cool one, I know there's a marketing firm that's having great success. They use predictive algorithms, and I'm not sure if it's quite to AI level yet, but it is certainly a predictive, a team of data scientists informing a model to predict when people in specific geographical areas are going to need an orthopedic procedure done. And from that, they can then market different clinicians and different physicians to these patients to help them find the best form of care.
Very interesting. So it's definitely there.
Yeah, I think I think the medical industry is historically slow to adopt it because because of how highly regulated it is, and because of the laws surrounding HIPAA.
Yeah.
So I do believe it is incorporating it, but it'll be slow because it has to prove. They have to be able to prove how it's protected.
On the product design, like path, you guys are working fast, right? Because like whoever innovates first with AI.
Absolutely.
Okay.
So that the sooner you can find a way to incorporate it, but it's such a huge field where I'm sure there's different scientific models, or science fiction is only science fiction because the technology hasn't met it yet. And so you look at some of the pop culture major movies where they have like AI assisted processing of cell cultures or chemical breakdowns and decay rates. That can all be simulated because it's simple math.
Yeah.
It's not simple, but it's simple.
Yeah. Well, thank you so much for talking. Do you have any last advice for anybody who might be wanting to get into the industry?
Yeah, my biggest point of advice is it's a very close-knit group, and it is a hard industry to break into. But once you're in, you're there. And so if it's something that you're passionate about and it's something that you truly believe in, then you can find a spot. And the biggest thing is, and I tell anyone for any industry, but specifically this one, your why, like why you want to, like there's Simon Sinek's my favorite TED talk of all time. He says, people don't buy what you do, they buy why you do it. So I think if you as a prospective student or learner of in the medical innovation world, right? People don't care why you do it. They don't care what you do. Like if you can, like I say, I can create a 3D model. Great. There's 1,000 people that can create a 3D model. I can create the best marketing brief in the world. Well, I can pay anybody to make the best marketing brief in the world. But if you can communicate and share why you do it and why it's important, that passion and that drive will help you be successful, because if your company goes up or down, or if the industry is slow, it doesn't matter, because your why is that you want to be a medical innovator, and you want to be a part of that industry.
Okay, so it goes beyond your skills. It's more about, like you said, attitude.
Yeah, that if you can, in whatever industry you choose to go into, if you can make it so that when they look at your resume, they look at your LinkedIn or whatever, if they can come away understanding why you are doing what you want to do, that'll help them connect with you on a personal level. And they can say, oh, I can see Victoria being on this team. Let's get her in there.
Okay, that makes sense. Thank you so much. This was super helpful.
And let me know if there's anything else.
Yeah, thank you so much.
Have a good one.
Thank you. Bye.
Bye.